Thank you, everyone. We're now moving to the panel discussion component. Just a reminder to use the app to ask any questions that you have, and we'll hopefully have time for some at the end. We're all going to be mindful of time, and I'm going to reintroduce myself. It's not because I think you've all got short-term memory loss, but we are recording this session and this will be published separately. So, all right, we're all good to go. The way this will work is I'll speak to each person on the panel separately, and I'll introduce them as we go. All right, well, hello there. I'm Jonathan Meddings, the chair of the Darbon Institute and author of The Final Cut, The Truth About Circumcision, and it's my pleasure to be moderating this panel discussion. I want to start with Jason Simmons, who is an ambassador for the Darbon Institute and a circumcision survivor who is bravely sharing his story here for the first time. Jace, how did you first become aware of circumcision harms?
Good question. My earliest memory of becoming aware of this issue was I was 3 or 4. I saw the aftermath of my brother's mutilation, my cousin's mutilation, and something just didn't seem right about that. Instinctively, I would pull the skin over my glands, not even knowing what an intact penis looked like at that stage. It just didn't seem right at the time. And then so fast forward to my early 20s, and I am out in the world and start to see advertisements for vasectomies. And I start to have a body reaction to this, and I start to have a fight or flight reaction, and I start to get angry, and I don't understand why. And that was curious. And then 7 years ago now, I had a groin injury, and I had to go to the doctors and be examined, and I ended up in a panic attack. And that process of being examined over several occasions, the panic attacks got worse, and then they didn't stop for 6 years. And I ended up almost ending my life, and I'm lucky to be here. Yeah.
Well, thank you for sharing that, Jason. How hard was it to find trauma-informed support services when you went looking?
Yeah, it's not easy, and it's something that I've heard other people, even at this Congress, talk about. Is seeking help is difficult. It took me 3 months to be able to get to a psychologist. That was just their waiting list. And when I did, it took me another 2 months to get my second appointment. So I was in a really bad place, and it took me a long time to get help. When I did, the therapist, I love him to bits, he's a fantastic fellow, but he went looking for another reason why I was experiencing PTSD. He didn't believe me that this was an issue, and still hasn't validated that this is the reason that I was having a body reaction and a body memory was because of male genital mutilation. At my lowest point, he said to me, "Jace, I don't know how to help you." And I sent him to the Darbon Institute website and 15 Square, who have also been mentioned today, referred him to their website, and he started to understand this issue. Our relationship as a therapeutic relationship continued for a while, and it kept me alive, but it didn't cure me. I went to the Amazon jungle and used psychedelics in Peru as well, and I came home from there finally with some joy and feeling positive about life again. And the breakthrough for me in getting care was seeking somatic therapy, which I'm doing every week, and that has been a huge breakthrough for me.
What would you like to see changed?
For me, there's 3 things. The first thing is what we've all sort of spoken about already, and that is equal protection of every child. It doesn't matter what their genitals look like. We all deserve the same protection. It's just as simple as that. Just as simple as that. And the second thing is that Medicare helped fund my mutilation, so Medicare should be funding my journey to wellness. I've spent a house deposit staying alive. I've spent a house deposit trying to free myself from this. And I believe that there should be an investment from the federal government on helping men like myself and those with a penis to get well. And if that involves psychological services or physical interventions or like regenerative medicine, foreskin restoration, those sorts of things should be supported by the federal government. The third thing, and probably the most important for me, is if you take nothing away from today, from my heart to your heart as human beings, I want you to see us and I want you to hear us and I want you to acknowledge the harm from this and our pain. Yeah? And I want you to stand with us and fight. Because the World Health Organization is pushing this again. And it's coming to a country near you. So stand with us and fight, because we stand with you as well. That's all. Yeah.
Thank you. Thank you, Jason. That was incredibly moving. I want to turn now to Dr. Leif Thompson, a physician from Alaska who runs a peer support service for 15 Square, a men's charity in the UK. And quickly, could you tell us, Leif, a bit about that service?
15 Square has a direction that they're trying to not only inform the public about male genital cutting so that better policy can and better education for decisions around this can happen, but they're also really wanting to create and foster ways to help treat men that are suffering from problems related to that. The peer support is an online support group that meets once a week, and it's international. We actually have roving times to accommodate how the globe has different time zones. And it's a place to gather, have support, not feel that we have to explain ourselves to be validated, and gain strength from camaraderie. So that's basically what this service is peer support. There needs to be, I think, I feel inadequate as a peer support leader without having the level of training that I think I might need to do this effectively, but this is a funding issue. There's limited funds, and being trained takes money. But I do want to just report one thing from the groups. There's a lot of deep emotional things that are shared, and it's a safe environment. But one of the things that's almost universal, I would almost say it is universal, is that everyone who sought therapy has been rejected. Their issue has been rejected by their therapists on the first go-around, as is my case. And I was lucky. My second therapist was spot on. It was really good. And for me, narrative therapy was the best for me. But this is an almost universal experience now. We really need, if there's psychologists out there and sex therapists out there, to get interested in this topic and help to build something new that's helpful. There's a real need.
Thanks, Leif. Would you also be able to share your story of circumcision harms and how has it impacted your Jewish identity in particular?
Oh, yeah. I was circumcised in part, well, the main reason why I was circumcised because I was born in the United States, and when I was born in 1963, everybody was circumcised. And just to give you an idea, in 1963, preventing masturbation was one of the reasons to prevent circumcision. But my mother is Jewish. My father is not. That's why Leif Thompson's not a very Jewish-sounding name, but I am Jewish. And my mom thought, well, we're not religiously Jewish, but if we do the circumcision now, then he doesn't have to get circumcised later. Let's do him the favor. So that's the Jewish part of my being cut. I found out at age 13, but I knew I was not supposed to talk about this. I didn't tell another soul that I was distressed about this until about 27, when I learned that there were other people, and it was like an emotional breakdown at that point. As far as the Jewish identity, I just want to make, there was a comment, I think on day one of one of the speakers was saying, talking about the cutting off of the foreskin as being identity forming. It's identity forming for the person deciding the cut. For the person being cut, it can be identity forming, but it can also be identity destroying. When I respect the Jewish culture, I am of the Jewish culture, but if I sit down to a Shabbat, I feel mild nausea. It's sitting in the house of the abuser. And for my case, my biggest obstacle with feeling Jewish is what was done to me under the auspices of Jewish culture. That changed for me recently when I learned of this organization called Bruchim. Bruchim is an organization trying to foster spaces for the discussion about circumcision and also fostering spaces for belonging for families and boys and men who are choosing not to be circumcised. So this change is happening within Jewish culture. It's not all, if somebody's against circumcision, you can't assume that it's anti-Semitic or coming from outside, because probably one of the biggest groups of people that are trying to work for genital autonomy is Jewish people. And the other thing, last thing, is that there is a lot of men on my peer support groups that have a similar experience. They feel like they can't be Jewish because of what was done to them.
Thanks for sharing that, Leif. I want to turn now to Tim Arkell, who is the Executive Officer of the Darbon Institute. Tim, could you start by telling us a bit about Darbon?
Sure. The Darbon Institute is a successor, I guess, of an organisation created by Paul Mason, the late Paul Mason. Paul was a Brisbane-based barrister who spent the whole of his life advocating for children in this space, and he was a world force, and he passed away in 2018 suddenly, and the organisation he created was called the Australasian Institute for Genital Autonomy. It was an incorporated association incorporated in Queensland. Without telling you how I came on, because we're running out of time, I was asked to become the secretary of that incorporated association because I'm a resident of Queensland. I'm also a lawyer here in Queensland. I'm a solicitor. For those of you from overseas, there are two branches of our legal profession in Australia. You are either a solicitor, like a GP, or you're a barrister, like a specialist. So I came on to the organisation as the secretary and trying to fill some very big shoes as a human rights lawyer.
Thanks, Tim. That's a really great summary of the history. Could you tell us a bit more about the activities of Darbon, the program areas?
Sure. There are a number of key areas that we're working on at present. Firstly, we're creating educational resources and programs for the public and for the healthcare profession to outline and point out to them the harms of non-consensual, medically unnecessary genital cutting. Parents need information to understand the moral implications and the socio-cultural triggers that lead them to seek circumcision for their sons, especially so given the rate of routine infant circumcision in Australia is now below 8%. And healthcare professionals need to understand that doing non-consensual, medically unnecessary male circumcision on children that are too young to personally consent or understand what is occurring to their bodies is a breach of the Hippocratic Oath, primum non nocere. Now, there's a link to a journal article in on the Darbon Institute website. If you go to the resources section and find the professionals' information, there's a link to a journal article, and I won't give you the name of the whole journal article, but it starts with genital modifications in prepubescent minors. And it will talk to you about the ethical problem of healthcare professionals doing this procedure on children. The second is that we're empowering survivors to share their lived experience in a safe and supportive environment. And you've heard from two fellows today, and you can hear more by going onto the 15 Square website, where by providing a safe and supportive environment, we're hoping that it collectively forges change and leads to different outcomes for future generations of girls and boys and the men and women that they will become. And thirdly, we're establishing trauma-informed support services. And I'm buoyed by the number of people that I've been able to speak to over the course of these last couple of days in trying to find appropriate trauma-informed counsellors. Ron Goldman, in a book written in the late 90s, outlined the harms of circumcision in a book called Circumcision, the Hidden Trauma. If you haven't read it, it's an informed source. We've heard today about the disenfranchisement felt by many men when seeking trauma-based therapies. And it's been noted in the literature, and Leanne spoke about it today. You can find a link to Leanne's study on the Darbon Institute website, www.darboninstitute.org. And the Darbon Institute receives many inquiries from men affected by this procedure. And as I said, we're looking to establish proper trauma-informed resources so that we can do referrals to properly train people.
Thanks, Tim. We are fast running out of time, and I do want to leave time for a couple questions at the end, but you are a lawyer, so we can't miss asking you what kind of liability practitioners who perform this procedure are exposing themselves to.
Sure, look, I'll speed up. Firstly, as a solicitor in this state, I am subject to ethical considerations. As an officer of the Supreme Court of Queensland, in my personal life, I am held to a higher ethical standard than the ordinary person in the street, okay? And it should be no different for a healthcare professional when people are going, and the unique position that they're placed in, when people are going to them seeking their advice and their care. Under the guidelines for medical practitioners who perform cosmetic, medical and surgical procedures, healthcare professionals are required to follow any relevant legislation in the jurisdiction in which they are operating, so hence here in Queensland. And the guidelines define major cosmetic, medical and surgical procedure as anything that involves a cutting beneath the skin. Now, it doesn't take you to be a lawyer or a rocket science expert to know that circumcision excises healthy tissue from the male penis. It involves cutting beneath the skin. It is a major surgical procedure. And further, the guidelines assume that you have obtained the personal consent of the patient undergoing the treatment. And when parents consent to this, that's not the person undergoing the treatment. Additionally, for healthcare professionals in Queensland, there is a prohibition on cosmetic surgery on minors. That is contained in a piece of legislation created by Anna Bligh back in the days when we had the lovely Anna Bligh as our Premier, and healthcare legislation, restriction on the use of cosmetic surgery for children and another measure, I don't know what that one is, 2008, and a failure to observe the guidelines and the prohibitions and the requirements in the Act could leave a healthcare practitioner not covered by their professional indemnity insurer.
That's great, Tim, and I'd probably just add to that, we've got criminal laws as well against things like serious and grievous bodily injury. Cutting off healthy tissue from someone who can't consent would certainly seem to meet that test. And I think there's a lot of practitioners who can count their lucky stars there hasn't been a test case, because we did in Queensland while we're here, we had I think it was a 1993 paper by the Queensland Law Reform Commission, which said it would appear to meet that charge. All right, well, can we give a round of applause to our panellists? We have 1 minute left for a great many questions. So I'm going to say you can certainly speak to all of our panel members today during the break, but I will quickly run through a couple. One questioner asks, what would you say to new or expecting parents who want to circumcise either due to religion or what they believe it being healthier or looks better? A short answer would be please don't. Allow your child to grow up and decide for themselves if they want to be a part of that religion through that practice, if they want to express their religious beliefs that way. We've got a lot of other questions we can't get to, but a quick note about Gary Dowsett is asking me, Professor Dowsett, if I can let you all know that there will be a call for papers from the Culture, Health and Sexuality Journal on VMMC and HIV. So keep an eye out for that one and get in your abstracts. All right, well, that's bang on 12, so I can hear it buzzing. So I'm going to keep my promise and keep to time. Thank you, everyone. It's great to see you packed room.